So now it's time to go to the panel. We have an incredible lineup of people today. We are so thankful and grateful for them to join this Superhero League episode. So I'm gonna try to be very brief in presenting them, because otherwise I'm gonna take all the time of the panel. You will see more information about the participants in the chat. Some mates are gonna paste it there. So please, I would like to put your camera on. Some of you already have your camera on. Hi, Gillian. Hi, Yasin. Hi, Joel. So, Anja, I see you there as well. So let's start. For example, I'm missing Alex and Gordon. Gordon is the founder of Crypto Law Partners. Yasin, that is already here, is a TED Global Fellow and Human Rights Journalist.
I'm here.
Hey. Just put your camera, please.
I'm also here, Alex. Hi.
Hey.
It's on.
Cool. So now that he appeared, Alex is the CTO of Kaelum Labs and co-chair of the Digital Identity Working Group at INATBA, the International Trusted Blockchain Association, and a recognized expert in self-sovereignty, identity, and zero-knowledge proofs. We have, as a last surprise, we have Gillian York representing the Electronic Frontier Foundation, that I think we all know the work of the foundation here. Thanks a lot for your work to protect our digital rights. We have Joel Konopo, who is co-founder of the INK Center for Investigative Journalism. We have Anja, who is the Chief Strategic Officer of the Future Law Institute and also President of the Blockchain Think Tank of Slovenia. And I think I don't forget anyone. Gillian, Alex, Anja, Joel, Yasin, Gordon, very welcome here.
We just want to hear your voices. Just to, as a starter, I would like to ask you, why do you think that governments feel the need to implement severe restrictions during COVID-19? And please also tell us if you are for or against this happening. Who would like to start?
I can if you want.
Please.
Okay.
So I'm, just for some context, I'm from the US, but I'm living in Berlin, Germany at the moment. And Germany is one of the governments that has, I think, some of the least restrictive rules at the moment. We still have, of course, social distancing and masks required in shops and public transit, but we're allowed free movement, and the contact tracing apps that are emerging, it's looking like we're going toward a decentralized model. I think in general, to answer the question, why are governments doing this? I think some of the measures, of course, the non-digital ones, let's say, are necessary measures for public health. And so I am in favor of some form of restriction, of course. But then I think when we get into the digital discussion, the problem there is the same problem that we see with governments trying to solve other problems, is that they often view technology as exceptional. So to give an example outside of COVID-19, I think if you look at hate speech, particularly hatred towards migrant communities, which is a big problem in Germany for sure, but the government here always looks toward the internet as the way to solve that problem, rather than, for example, implementing integration courses or courses in schools to teach kids about how hate speech is bad, really kind of getting to the root of the problem. And I think that's what we're seeing here now. I'm not an expert on contact tracing, so I'm a little hesitant to weigh in, although I can certainly share the work that EFF's doing. But I think the things that I'm watching the most right now that are really concerning me are governments and, of course, social media companies as well, and other types of tech platforms restricting speech.
How do you see it, Alex? You are very close with the working group of INATBA in Brussels and so on. I guess you have been of course, tell us what you can. I'm particularly interested in that opinion of yours, in digital and physical.
Okay, I'm back. I agree, and honestly, I've been closely working with a few groups, not just INATBA, but a few other groups, with epidemiologists and politicians, also working on a solution for that. And at the beginning, and yes, I've been looking at all of the different contact tracing solutions out there. So I've been following all of the technologies, and at the end of the day, I just feel like it's the easy solution. It's the easy path. So it's like escalators. Like we have escalators everywhere. They help us.
Sorry, Alex,
yeah. Like
that tracing is a solution.
I don't like technology. Like every time I use more technology, I don't like it. I think technology makes us lazy and makes us stupid at some point. And most of the governments they use that in their own advantage. They like us being stupid. So basically, the more stupid we are, the more we vote them. So technology, it helps a lot. Escalators are exactly the same. The more we use escalators instead of stairs, we get fat and we are easier to control. And when it comes to instead of, as you say, like we should be more informed. We should learn more. We should be responsible. It should be our decision not to go out to the street because it's not good for us, but it should be our own decision. It should not be our mobile phone telling us what to do. In the last few months, I just changed my mind from thinking that the mobile phone was an amazing thing to almost hating it a little bit. And believe me, I've been like looking really deep into the technology behind contact tracing. And at this point, I think it's one of the most dangerous things out there ever. And even more if it's in the hands of Google, Apple, or all of these kind of companies. But it starts with, okay, yeah, it helps. But at the end of the day, we don't know where it's going to go from here. And how is it going to use it? And we are going to put it on the mobile phones as some kind of basic layer for anything. So now they know us a lot, but they will know us even better. They will know everyone we speak to. So our social life will be part of this profile that they have from us. I'm really scared, honestly.
So I hear Joel's opinion. Do you think, Joel, that people are stupid, like Alex was saying, and lazy, or people are completely afraid and agreeing to anything without processing that in their heads? What's your point of view, Joel, on that?
Okay, great. First, I should say I liked your improv. It got me thinking a lot. It was brilliantly done. Why is government doing this? I think partly, as one colleague had said, it's necessary to from a health point of view to try to ensure that the public really, especially in the context of Africa or my country, so to speak, so the public relies on government mostly because of the structural reasons. So they rely on the information from government and they trust it so much. And then the existence of technology comes as sort of tries to balance that. And that is why, in our case, politicians are so skeptical or very suspicious of technology, especially in the free world where you see Facebook, anyone can publish anything they want. For politicians or authorities generally, it scares them because they don't have control of the narrative anymore. There are influencers who actually are following more than they do. So it becomes a problem for them to control the narrative. In that context, it really scares them. Governments are not experts in terms of controlling or fighting misinformation generally. And you'd find that when they are not experts, they also want to play a role at the same time, and obviously making clashing with people who could be better placed to really help reduce the spread of fake news. And I'm saying this in the context of my country and my neighbors. I see a lot of concern on the part of authorities concerned about the spread of fake news not because there's a lot of spread of fake news, because they don't have control of the narrative. That's what I think.
Yeah, interesting. It's so great to have so diversity of views. I was still, Anja, I'm curious because you have been very vocal about this in past editions. Do you agree with Alex that tracing solutions are important, are something like that we really need?
Contact tracing is important, but the concern, and like anyone is saying, is the fact that there is now a lot of information that we don't have control over, that is out there. In the case of Africa and particularly Botswana, the information has become so much that initially there wasn't that information on the hands of authorities about almost everyone, because every shop you enter, you need to be sanitized and you need to write down your names. And we don't know how that information will be used. Contract tracing is really important, but the fear is that how the information will be used by it be Facebook, Google, but particularly repressive government.
Anja, please, what's your view? Don't you think maybe it's an excuse, or?
I mean, these are very interesting questions. I think to some extent it's actually necessary, basically because our world has become so institutionalized that the information flow and the speed of information is slowing down. So, for example, for the epidemiologists and all the centers that are here to help us with the health system, it became very necessary that the reporting actually comes from the individuals. Now, if we are talking about surveillance, or if we are talking about just locating all these individuals, if we provide this information on a voluntary basis, then it's okay as long as somebody does not abuse that information. But those are two different questions, I think. Basically, what you mentioned in the play that you presented at the very beginning of this is the rule of law, right? And how much we actually trust that the laws are here to protect us and our interests. I do believe that the laws are basically based on the ethics. I truly hope so, and I will continue to believe so. The laws, to some extent, always follow the society, and what we've observed here is that we are not really able to form consensus in a big, broader community. That's one. And also there is an issue on how governments and how we make the response a coherent response, especially when the disease spreads so fast. We definitely need to achieve the coherence between the states. So to some extent, we have to rely on the government or on some trusted party and global actors to react in an appropriate manner. This is why I'm trusting and I'm relying on our governments to take care of whatever is happening in my country and to communicate that to other countries. And this is why I trust the rule of law to take place, even though we can see in some of the countries that that's not the issue. The issue is that the rule of law is actually being abused against the individuals, and the surveillance measures are being very strict, and some people are even being shot if they leave the quarantine. This is when the rule of law becomes too strict, and we saw that in Nazis' era, for example, when the positive law was against control. It wasn't really legitimate. To kind of go with what Alex said, I love the analogy with escalators. At the same time, I think that when it comes to technology, I mean, it's pretty much what Bill Gates said. Whatever is being efficient is going to be magnified in efficiency, but the same goes for the inefficiency. So whatever we had and we kind of automated it, if it was inefficient from the beginning, then it just magnifies. And whatever we are automating or whatever we use the technology for, we have to be mindful of potential bugs. And same goes for all surveillance measures, same goes for all the technical abuses that we are seeing now. But the states in different countries are so different. I mean, we were speaking to people from Singapore. They're already using a lot of these apps. They're having the QR codes, scanning whenever they leave their house and go to a store. Their government even promotes and uses WhatsApp and Telegram channels. To me, how the information spreads between the civilians and the country is amazing. This is something that they achieved, but basically they achieved it because all the citizens very much trust the government. That's not the case in Europe.
We all agree that contact tracing and tracing apps are needed. Welcome, Gordon.
If I'm thinking incorrectly. Sorry for joining late. Where are you located? What country are you from?
I'm based in Slovenia.
Sorry, where?
Slovenia.
Slovenia. Yeah, I was appreciating the fact you guys can trust your government, or at least the people trust the government. I'm in Los Angeles right now. It's a mess.
Also, Gordon,
sorry for joining late, and good to see everyone.
I had an impression for your comment and your question to Anja that you are in the side of not trusting governments a lot, right?
I would like to, and it kind of depends who's running the government. The benefit and the curse of the United States is federalism to the degree we have it. Plus, there's a national character of the whole point of the United States is limited government. And so those things are great in some circumstances, but they're less effective right now. When you're, I mean, the point the prior speaker made was right. I mean, it's hard enough to coordinate responses amongst countries. It's much harder when you have strong localities or 50 quasi-independent states within a country, and you get this combinatorial issue, especially when borders or land borders and they're close. And it's just, it's tough. I mean, I was reading some stuff this morning. I mean, maybe the ideal situation would be to test everyone and do track and trace and to isolate for their protection the more vulnerable populations. I think the U.S. has kind of given up on that. I think we just realized we don't have the capability to do that. So we're backing into the Swedish model, not because we chose it, but just because we can't do anything else. Like, we're incapable of doing anything else, it seems. I mean, obviously there's bright spots like I think New York and California, but you got other places. I mean, I'm personally in favor of gun rights, but when I see a bunch of people in Michigan dressed in camouflage with their weapons walking into the State House protesting the lockdown, you know, that's not what I personally had in mind. So, you know,
what would you say? There's a project from the US. I think they're based in New York called COVID-19 API. Basically, they're creating an API and are crawling the data from the official websites from the governments, reporting the numbers. What they're actually seeing now, and this is why the need for decentralized apps, for example, and the tracing perhaps, is that a lot of these countries are reporting just the raw data that is not connected to any other data from the participants or from the people that are being tested. So we have no whatsoever information whether those testings were or no connection that we can make between the positive tests, the age, sex, and the income of that person. And what she was explaining to us is that is basically a political question from a country, because they know how easily that data might be manipulated. And also, for example, in New York and a lot of different states from America would actually have to admit that a lot of people of color are being heavily affected by the disease, much more than, for example, white people. And they're simply not there yet. They don't even want to deal with that information because they don't have the capacity to have that type of PR.
I think there's a lot of that. There's also, when you're doing, I mean, I think the inclusion of the term API may be a little bit ambitious in the name of that group, because a lot of these data sources aren't accessible by API. I think they're having a web scrape, which is unfortunate. And you have all these different data silos and that are using incompatible formats with no one in charge, and it's rough. I mean, we definitely do not have accurate data. There's that worldcoronaviruscount.com account that I keep on refreshing. It's interesting how other countries are more granular in their caseload, but the United States either has nothing for a while and then it jumps. And this website's pretty good about some other locations. Also, it's, I guess you're saying like we're describing COVID API being useful for tracking general trends. It's going to be hard in the United States to track individuals. Just for the privacy reasons, and just we got such a diverse. Fortunately, we're not unified in one database. And I don't want to be like a big negative figure this way, but I'm just troubled by the United States, our lack of coherent response. It makes me nervous. And I'm a little bit jealous. I just saw a news this morning that the Czech Republic reopened their beer garden, and that's the first time I felt emotionally affected by COVID. So I want to get a beer garden. Damn it! Meanwhile, I'm stuck in my lobby with my house with my cat.
Yeah, Gordon, I think Gillian, a fellow American, has something to say. Raise your hand, so please. Gillian, let us.
Hi,
I would like to ask Gillian a question, specifically about. I know she works in human rights and regarding the lockdown, that sometimes it could be seen as a way of oppression, being forced to be locked, and it seems, at least to me, like governments have prioritized health over security. For example, in the cases of domestic violence, what happens with thousands of people being locked with their aggressor, right? 24/7, little chances of getting help. I can see Joel nodding his head, so maybe we can listen also to Joel's opinion after Gillian on the matter, you know, because it's like, who decides which is more important to prioritize, and why is in so many days of a lockdown there's no solution for this? So I would really appreciate to know your point of view, Gillian, and then if you could lead your to Joel, so that we can also share the point of view. Thank you.
Sure, that sounds great. So yeah, I mean, I was nodding along with the last one, and I will be answering this question for sure, but I think it's really worth noting just how different all of the situations in different countries are. And I've spent a lot of time, you know, this is a very global call. I've spent a lot of time on this kind of call over the past couple months. You know, my friends in New Zealand are now back out having beers because their country did such widespread testing and contact tracing, but also because it's an island of 4 million people who kind of know each other. So, you know, I mean, I think these differences are really important to note. To your question really specifically, I think that the country by country analysis really does play into it, right? Because I think part of the reason that the US or responsible cities in the US have been strict about lockdown is because they can't get away with what Germany has, because there isn't enough space. I mean, I've lived in San Francisco. Other than Golden Gate Park, I don't know where you go to socially distance and get some fresh air. And I think, you know, if we look at some of I'm really interested in kind of the island countries and how they're doing, because it's a really interesting comparative analysis, right? But Singapore, to your point, we've seen the lockdown there result in the kind of upper class being largely free of COVID, and the workers, migrant workers who are living in really close quarters, forced to be stuck in this lockdown, getting infected because they're all close together, very similar to prison populations. So if we look at, you know, prisoners and migrant workers and anyone who's living in poverty, we look at domestic violence situations, I think that, and as well as the kind of the curfew thing going on, like I don't really understand the countries that are placing nighttime curfews when that essentially limits the amount of time that people can be outside and get some space. I walk around at midnight in Berlin and it's empty, so it's great. So I think that this is where, you know, states have failed to take into consideration the needs of some of their most vulnerable populations. And it's absolutely, you know, I think it's absolutely becoming, if it isn't already, a human rights violation that needs to be looked into at the highest levels.
So Joel, what can you let us know your opinion about this, please?
Yes, I would say like anyone else, I think the COVID-19 caught all of us by surprise, including the government. So what happened was that, in our case, is that the pre-existing economic inequalities and gender-based inequalities, they kind of fermented when people are locked up, and alongside the frustrations. And you know, there's always been an outlet to avoid confrontation, whereby when there's no lockdown, whenever there's a potential confrontation, people could walk out. Now there's nowhere to go. I think from that point of view, the challenge that has been showing is that there were no gender-based violence services, such as there was nothing non-COVID interventions. Everything has been focused on COVID, to a point that other challenges have been sort of put to the side and ignored. If you take example of Africa again, look at the cases of malaria, they are increasing, and there are concerns that too much focus on COVID might be alienating even cases like HIV/AIDS, whereby there might be people not getting their drugs as frequent as they should because their attention is so much on addressing COVID. So what it means is that there hasn't been any other intervention that really comes to address other issues, and more especially GBV. That's what I think.
Great.
Oh, thank you so much. I'm really sorry that it didn't go through so well, but I have been following and I have been hearing all the excellent discussion. What I want to say, to add on, is that actually, as a civil society, we need to start pushing back on some of the restrictions our governments are putting in place recently. And if we don't do it now, it will be very much difficult to push back after some time. Because what happens is that whenever there is an emergency, these restrictions come in place. We are all fine. Okay, it's an emergency. Let's the government do what it has to protect us. Finally, the government, when it attains extra power, they don't often give them up. So we are going to see all these restrictions that are coming due to COVID-19 virus overstaying the pandemic, and the governments are going to be using them to threaten everyone that is trying to speak truth to them. I will tell you one example of one of the laws of emergency that is widely abused. That is the law of terrorism. Today, when terrorism first appeared on the scene, we were all alarmed. And we let the government, okay, if it is a terrorist, you don't need to charge them. You don't even need to try them. You can do anything with a terrorist. You know what happened afterwards? Every opposing opinion became a terrorist. Every opponent of the government became a terrorist. So this is what we are gonna. This is what is gonna happen. That if we don't push back today to tell them, right, there is an emergency, but you have limits and orders, this is gonna go on. Mariana, I have a peculiar experience with censorship. I was in Dubai for more than 10 years, and after I wrote a book, the government was so much angered by my book, and they had me deported. And yeah, that's right. That's what happened. That's my experience, and things haven't been so good since my expulsion, my deportation from Dubai. Right now, I'm in the United States working as a caregiver. When you go to my polls, I'm an example of someone of how things go bad when you try to speak to the government. They always give me as an example. But one thing that I'm so grateful about is my comment. Despite all that has happened to me, I still have a voice. I can still talk on these platforms. I can still. So there is always challenges. Let us try to speak up and let us try to push back.
Yeah, great message. I guess, Gordon, you are the only one here that is now in the United States. And going back to the title of the panel, how are the response plans will affect citizens, are affecting citizens beyond the crisis, as probably what happens in the United States is going to spread somehow. How are you seeing the situation now about how people is being affected?
There's a lot of frustration.
With government measures and the plans enacted and so on.
Yeah, it's a little bit of what I was getting at before. There's such a diversity of point of view in the United States that it's hard to discuss one coherent view. I'd say there's a few views. I mean, I think there's confusion because it's one idea, which is we were supposed to be under lockdown so that the healthcare system, the idea was to flatten the curve, not to eliminate the virus in the US. It was, by the time we got our act together and started responding, it was probably too late to stop community transmission. So it became more of a management type thing. I think we're seeing other countries actually potentially eliminating the virus. In the United States, we got past that point pretty quickly and it became more of a management thing. And the term everyone used was flattening the curve, which is rather than having a huge spike of infections at once, that would overwhelm the healthcare system and lead to all these secondary effects, to moderate the infection rate such that there was time for everything else to ramp up, to get enough ventilators, to get enough hospital capacity, to do all this other stuff. What's happened is sorry, my cat's kind of attacking me here. What's happened is we've all been stuck indoors for 2 months. I'm going a little bit stir crazy. Like literally this is my best friend now.
Hey,
this is the only person that talks to me in person. We've been stuck indoors for 2 months, and supposedly this time was going to be used to flatten the curve, build up capacity. Now the restrictions are breaking down because all the states are kind of saying enough. We need to get the economy going, but I don't see much evidence that we built up capacity. So, I think the plan now, like I said, I think is for everyone to get infected and get over it, but it's not going to happen in a controlled manner. So it's going to go a little bit nuts. Now, I think the question was more like censorship or control or apps, or can you restate?
Yes, it's like how the plans that had been enacted, and one is the lockdown, and I think it's clear how it affected us, but more like the like measures that can, for example, it's clear after September the 11th, like it was the first time, maybe at least that I remember, that people was just like accepting compromising privacy for security. So I guess this is like another step further, and I would like the question, and also Gillian is maybe monitoring how the freedom of expression is being affected with regards to COVID. How is this being lived in the States, as it is very probable that that feeling and that way of acting is spreading in other countries?
Well, okay, so let me address the first one. In some, it's funny, the number of people, the number of people who've died in America due to COVID, assuming the numbers are accurate, are somewhere like 30 or 40 times the number of people who died in the 9/11 attack. And it's only going up. But for a brief moment, there was sort of the rally around the flag aspect, and Trump's approval ratings went up, and Dr. Fauci, who's like the main guy, him and Dr. Briggs were giving presentations. Everyone seemed to be sort of on the same page. What happened is there was talk of federal, i.e. national standards being implemented, and even some talk of New York, which was the epicenter at the time, being put under quote-unquote quarantine. But then there was a federalism conflict, and the idea was, short of war, we don't actually have the constitutional power to impose something like that. And so I think the federal government started going into sort of suggestion mode rather than mandate mode, and also basically gave the direction to the states that, look, everyone's kind of on their own. You need to go get your own PPE, personal protective equipment, and N95 masks and everything else. They were going to help. They sent hospital ships around. They did a stimulus, but there wasn't too much federal coordination. Now, one thing Dr. Fauci, I don't know if he's famous over there like he is here, but he's a gentleman that, always appears on the news and is always giving press conferences and always kind of standing aside or behind Trump, at least until recently, and trying to control his facial expressions. Him and the CDC, the Center for Disease Control, and all these other agencies came up with a plan about how the loosening was supposed to happen, how we were supposed to emerge from lockdown based on certain milestones. And the fact that there's milestones seems to have been completely forgotten. And all the states are opening in an ad hoc manner. So, to get to your broader question, there isn't sort of a national strategy or national message in the U.S. that I can see. I think there's also real concern about the economy and the fact that, to get to the prior question about domestic abuse and everything else. There's all these secondary effects that are happening that may even be worse than the virus. We just don't know. It's kids staying out of school. It's domestic abuse. It's people losing their jobs and missing their rent payments and everything else. People die from suicide also. Also, we're getting a weird dynamic in the U.S., which I think is also the case in other countries and is different from the H1 virus, which is the world's become older since we had SARS and since we had the H1. And the United States has become older and Europe has become older. And this virus seems to be playing on a generational issue as well, which is the fact that it leaves young people relatively unaffected. There's some contrary evidence, but the vast majority of cases, young people are unaffected. And then you hit 40 or even 50 like yours truly, and then it kind of steeps up, especially if you're not healthy or have diabetes or something else. There's an element, I'm picking up, at least not on formal news, but on everywhere else, there's an element of why should the young people who are safe, lose their lives for this period when it's other people being affected? There's sort of this okay boomer aspect.
Just in case, Gordon, this is like it's just in case.
Yeah, just in case. There's a meme going around in the U.S., which luckily I'm not part of this generation, but it's the okay boomer meme, which is the idea that the generation that followed World War II was very self-focused, kind of burned everything for everyone else, built up this huge debt, wasted the United States international position, and just was kind of like 1970s and 1980s hedonism and money. And there's a feeling, I think, along the millennials that these older generations spoil the party for everyone else. Because now we're going up in the 2020s and 2030s, which are going to be rough, and they didn't have to be. And I think there's a meme or a feeling going around that the older generation, they don't want them to die, but they don't want to delay their life because of yet another issue caused by these old people. So it's not I don't want to play a picture. There's a lot of people sacrificing. There's a lot of people working hard. There's a lot of people self-quarantining. There's a lot of people worse than everyone else. But there's a lot of different strains of you. It's hard to figure out just one. And I think to get to the prior speaker's point, island countries or small insular countries, especially ones that are demographically similar, don't seem to have this issue. But yeah, the U.S. is special.
Jillian, yeah.
Just a quick note. I do kind of agree with that in some ways. I'll, for full disclosure, I'm an elder millennial, born in 1982, so kind of almost Gen X. But the boomers did kind of screw it up for a lot of Americans. But I also think that it's more than that. I think it's also the difference in culture. Being an American that lives in Germany, there's such a difference in American culture. Is like every man for himself or every person for themselves. It's very individualistic, and so it's not just the not protecting the older people. It's also just not really caring about, like, nothing is done in the spirit of solidarity there. Whereas, I think in Germany, again, we definitely are seeing, like, I can look out my window and see groups of people not following the rules for sure. But by and large, I think that most people here, not only is there trust in government and that kind of like obedience to it, but there's also much more of the feeling of solidarity here and it's embedded in everything from the healthcare system to, we all have to pay a TV tax even if we don't own a television.
Yeah, it's funny you said that. I actually studied in Germany twice, and I loved it there. And I remember staying there and having the TV police, the Fernsehpolizei, or however you want to say it, come to my apartment. I don't have a TV. They're like, well, we need to come in and see. I'm like, what do you mean you're coming in? It's like you're not coming in. Get the hell out of here, says Einstein. So,
We're receiving,
you get the irony. So,
questions from the audience.
It's definitely cultural.
Yeah, there's a question for Anja in the audience. Do you think, to all speakers, but especially Anja, and it says, do you think there should be an international legal framework or protocol in cases of pandemics where people will be required to abide by certain rules plus standards for governments, like requirements for what they are to provide their citizens during lockdown, as well as restriction of what governments can and cannot, some kind of regulation, right? If it has been established before, or it's in a project to be established, something like this, like an international organization that like sets the limits, to say it in a way?
Yeah, I hear you. It's a very good question. This is basically why WHO already exists. So the World Health Organization. It came into existence through the UN. However, the problem that we can observe more and more lately is that a lot of these types of institutions are basically coordinated and put together by the nation states. However, there's a power dynamic switching from the nation states alone. So, for example, now America withdrew from funding the WHO, and the biggest funder right now is a private organization led by Bill and Melinda Gates. So this is the shift that we can observe. However, the fact that WHO exists and the fact that China is now being sued by the US because they apparently did not follow certain rules when it comes to the pandemics already applies that we do have some sort of an international framework in place. Especially for how we and the nation states and the governments report the numbers when they observe that the pandemic is kind of breaking out. But I mean, it's not only that there's a power dynamics shift from having public institutions now funded by the private sector. It's also that with a pandemic like this, what needs to happen, or what we need to establish as well, is some sort of a self-regulation. You cannot simply apply same rule. There's no formula that is going to fit them all. We have seen pandemics before. This is not the first pandemic. It's probably not the last one. The problem is that we don't know what happens next. So, for example, in 2015, Bill Gates already, I mean, I'm not a fan of Bill Gates, don't get me wrong. I'm mentioning him quite a lot, quite often, but I'm not a fan. he did mention in 2015 when he had a TED talk that there's going to be probably a pandemic that is going to kill many, many people, and that if we're afraid of something that is going to kill many people, it's not really the war, it's not the missiles, it's actually the bacteria and the viruses. And even though that was 5 years ago, there was not really a lot of resources and a lot of people working on the international regimes, working on a vaccination and stuff like that, because we simply don't know what's going to hit us. So even with a regime in place, not only does it take a long time for the international treaties to come into place, there is like a huge problem also on how these international treaties are going to be effectively enforced, and we don't really know what happens next. What we do know, and this is why we actually established the GCPR initiatives, where we are trying to collect a lot of lawyers, a lot of system thinkers into one place where we collect or do the sense making together, and collect all the policy responses from different jurisdictions. This is what happens next. Knowing how countries are responding to the crisis means that this might actually be something that we put in place every time a respiratory disease hits us. We are also able to track and graphically present how countries, for example, responded. And what is quite insane to me is to see that a lot of these mortality rates and the policy responses came into place, for example, in Panama, in Monaco, in Luxembourg, and in countries that have high international traffic. So those countries can be perceived as hotspots. So next time we are dealing with a pandemic, we need to think of how these countries that are perceived as hotspots react first so that they prevent the disease from spreading very fast. But this is also something that we now need to research. And I think we all can agree that, the learning curve of a human being, it needs to repeat quite often so that we learn along the way. And this is how the law should be created as well. It's not really something that we should just put in place because something happened once. It should actually follow and become a tradition and become a custom. This is why usually or quite often the international law is based on the customary rule of law or customary principles, something that has existed for quite a while. And a lot of jurisdictions or a lot of countries perceive that as to be the rule, the law that applies. I hope that kind of answers your question. But yeah, it's still something that I think is in development phase. Some sort of rules definitely exist already, but there needs to be a lot more done, especially, for example, when we think of the global official gazettes or something like that.
We still have 5 more minutes, so Yasin can't even participate a lot. Alex, you're mute, and Joel, if you want to make any remark.
Yeah. I also just a quick question, Alex. This question goes to you. So, like everybody's waiting for governments and regulators to step up with something that will help us all. But from the open source community, blockchain community, but open source community, we just proved that we can do really big things that are global and based on collaboration and on competition. One of the things I've learned right now working with governments is like every time there's a problem, we receive like literally hundreds of people that they want to make money and they want to sell solutions for that, but no collaboration, just competition. So could we learn something from the open source community that we could apply to these kind of situations?
That's why when we are here, but still, Alex, I really think that's why I guess we made the question. I'm a firm believer of collaboration amongst competition, but I'm moderating, and I want to leave also Joel and Yasin and the
Alex, sorry, there's 2 of you on the screen and there's a huge echo.
So I pass it over this question of collaboration please to Yasin, and I'm particularly interested in hearing his opinion too.
I think the virus, the pandemic, the coronavirus pandemic has given us an opportunity to reach out to all the capacities and the energies that we have as human beings that we never knew that we already do. And the civil society has been much more on the front lines of trying to educate and trying to inform everyone what is right and what is wrong. What has struck me personally is that like censorship and everything, I have witnessed how the United States is very much similar to all these other developing countries, especially when it comes to digital surveillance and all the speech control. that is going on internet. The internet is the only platform that is left out to the people to express themselves in kinds like this. And that's the only way where people can meet. It is on the internet, where people can collaborate ideas and can build up ideas. And we expected this kind of, this kind of surveillance, this kind of control to be in Uganda, where I came from, to be in Togo, to be in Botswana, where my friend Joel comes from. But it is in the United States where it is really disheartening, and it is very important to everyone that in future, when we are drawing lines of collaboration as in society, we need to understand how so much the government is looking and how so much we can overcome. We should not only overcome pandemics onward, but we should also be coming up with ideas how we can overcome the government surveillances, how we can overcome the speech controls imposed by the governments, and how we can thrive as a community, all of us. Do I try somewhere close to Eric? Thank you, Eric.
Yeah. Joel, please give us some, we are finishing, give us some remark, please.
Yes, I was going to say when it comes to collaboration and how during the pandemic, how countries and companies have come together. If you look at the case of Google and Apple coming together to come up with an app, to develop a smartphone app to track the spread of coronavirus, it shows that during a crisis, private sector and communities, as my colleague has said, can really come together to have a common solution on a problem that affects everyone. But what I want to dwell on here is that is the small community in rural areas in my country and really elsewhere in Africa, where government doesn't always reach. They manage to come together as well, the same way Apple and Google did, but small communities coming together to design their own solutions to how they can disinfect themselves, like having simple mechanisms of handheld devices to wash their hands without really having to contaminate each other in the process. I found that, in a very remote areas where it's not easy to get to, where communities really do such things. For me, you will realize that human ingenuity is something that is really lives in us. People are able to come up with solutions to very complex problems when they are given opportunity to do so. Sometimes at the absence of governments. And for me, it's really helpful.
Yeah, really.
Thank
really
you very much for that input, Joel. Thank you very much, every one of you, for joining, for the amazing questions and the interaction that we had today from the audience. We will see you next week, and now we're going to continue with the Devs Show and all about state channels. So if you could, speakers, I say goodbye, and Omar, maybe you can turn on your camera, and Eric, and you can
in the networking in the networking we can continue, because with these people this conversation could last forever. So if you feel like after this awesome session about the state channels, we can start the discussion. Thanks everyone a lot.